Thank you very much, first of all, Isabel and colleagues, for being here. And thank you for inviting me to speak. My speech took a little bit of a turn 2 seconds ago, actually 3 minutes ago, when on Fox News it was announced that Syria tried to attack the United States with drones at our base in Syria. No one was injured, we took them out, but President George W. Bush referenced the axis of evil in 2003. He said China, Syria, Iraq, Russia, Iran, and North Korea would be engaged. And certainly with the atrocities that he has done in the Ukraine, we see that axis of evil, and with the atrocities in Israel. So it is my mission and my focus to be able to focus on my fellow veterans. How many of you served in your country's military? Could you please stand? So many of them have already left the room, but Jacob Crawford, who is with me and is with JAD Associates, is a 100% compensated veteran from the United States Army in our war on terrorism in Afghanistan. I am a United States Army veteran. I am the CEO of JAD Associates. I did receive the Meritorious Service Medal from the United States Army for public service recently, and I have a lot of credentials behind my last name. For veterans, it is important that we increase the knowledge and understanding of the full cycle of the veteran needs to include their family needs and their family members. And as my colleague from the Ukraine said, please take some time to get to know your local veteran, reach out to them, and find out what they may need. Sometimes it's talking, sometimes it's a job, sometimes it's a career, employment advice, and sometimes it's finding out if there's a benefit available to them. In the United States, we have unemployment benefits. I don't know if the Ukraine has that for their veterans, but sometimes it's just helping someone figure out the paperwork. The development and maintenance of an effective and efficient database for veterans is critical. And I was pleased to hear you say that we at the United States have been helping develop that. And I think that's one of the most important aspects of veteran support, because if you don't know where your veterans are, you can lose track of them rather rapidly. Addressing and expanding employment opportunities for the veterans and their family members who are also victims of war. No one is a victim of war by themselves. The wife, the spouse, the children, everyone, the grandmother, the grandfather, the aunts, the uncles, everyone is a victim of the war, but making sure that their family members, the immediate family members, are taken care of is critical. Expanding vocational training programs for your veterans so that they can improve your skills, just like my colleague from Ukraine said. We don't all need doctors and dentists. You need a plumber once in a while. You need somebody to unstop the toilet in the sink. You need a carpenter. You need an electrician. Make sure that there are trades available and trade training. Establish and maintain job prospectus programs for veterans to gain employment. And this was very exciting yesterday, Isabel and everyone. I wanted to say the amount of people that talked about jobs and talked about what they have to offer in the Ukraine and how they want to help rebuild is just evidence that people are on mark. Increasing mental health services for veterans and families. A veteran's worst wounds are the ones you can't see. Post-traumatic stress disorder and traumatic brain injury are two of the biggest proponents of suicide in veterans. Expansion of veteran service organizations, your NGO, your service organizations, but they have to be tasked with being able to work with governmental agencies, because if you can't work with the government, you aren't going to get anywhere, and the veteran is going to be the one that suffers. You have to be able to work together. It has to be united. So how do we fill the critical gaps for veteran reintegration? You have to have a healthy veteran before you can reintegrate them. I am honored to be working in collaboration with Dr. Teresa Bender-Pape from Northwestern University. She's a research professor and a clinical neuroscientist. I am also thrilled to announce that in the U.S. that there are different types of magnetic brain stimulation, and they are being used clinically with people who have major depressive disorder and who did not respond to standard treatment. And standard treatment is normally pills. It is also being studied for many more neurological conditions, but for traumatic brain injury and PTSD, they are co-occurring mental health conditions, and research on these is very limited. We are in the research phase now. I'm also, in conjunction with Northwestern, working in collaboration with Gary and Regina Bartels with the Outdoor Association for True Heroes. Gary is a West Point graduate and a 2-time combat veteran. He came home from Iraq, he sat his suitcase down, and he pretty much had a nervous breakdown, and he said there's got to be a better way to fix things. So now I am going to be honored to show you a short video that is with Northwestern and Dr. Pape and Gary Bartels.
Traumatic brain injury occurs when you experience a violent jolt or blow to your head, and it can affect your functioning in everyday activities and quality of life. Mild traumatic brain injury is often referred to as concussion. Persons who suffer mild traumatic brain injuries may appear relatively normal, but they may suffer from persistent fatigue, headache, attention problems, difficulty thinking, and other long-lasting cognitive problems. When a mild traumatic brain injury co-occurs with post-traumatic stress disorder, these impairments are even worse.
Biggest thing I noticed was less forgetfulness on short-term things. That's been a huge relief, I guess you could say, in a way. Better focus on different projects I'm working on or any work assignments that I'm doing, so that's also nice too. Being able to stay focused and work on the task at hand. The other thing too that I noticed was better sleep. Easier to fall asleep, easier to actually stay asleep. There's less wandering or restlessness of my mind when I'm trying to go to bed. So it's been nice to get better sleep and feel refreshed in the morning.
My Neuroplasticity and Neurorehabilitation Lab is dedicated to developing treatments that aid brain recovery after the damage caused by traumatic brain injury. Neuroplasticity is simply the ability of the brain to adapt and relearn skills that are necessary for daily life, skills that were lost due to brain injury. There are currently few to no treatments that can reset the brain's ability to adapt and learn after it has been injured. In my lab, our treatments include stimulating a patient's brain activity with non-invasive procedures such as transcranial magnetic stimulation, and immediately followed by brain training exercises. Our work is focused on developing personalized treatments that help reset the brain's ability to recover, adapt, and relearn skills. By addressing this critical need for treatments, we restore hope for our patients and their families.
Returning to civilian life after wearing the uniform is a tough transition. Few resources exist to reintegrate America's heroes once their service is complete. The Outdoor Association for True Heroes, or OATH, stands in the gap for those who stood for us. We serve and minister to eligible veterans, current service members, first responders, and their families. OATH fosters camaraderie, fellowship, and healing through outdoor activities and events. Heroes serving heroes is the most successful way to help our warriors. Stand for those who stood for us.
These two programs are working together. Dr. Pape is going to be treating the veteran with the magnetic brain stimulation, and then the veteran is going to go on the outdoor adventures and be able to integrate with other veterans. The Outdoor Adventure Organization also has a Warrior Wives program and a children's program that make that full circle of family unity happen. And I guess in closing, the only thing I could possibly say, having lost a husband on active duty and 2 children, one to murder and one to gang violence and the other to a Jeep explosion, is that freedom is not free, and I honor all of the Ukrainians that are here today. I honor all of you that are here as companies and NGOs and people that want to get involved in helping rebuild Ukraine, and I stand united to help you too. Thank you so very much.
Thank you so much, Ms. Dubose.